Hello, for the context of this assignment, I'm going to be a daytime ICU nurse giving an SBAR to an oncoming nighttime ICU nurse at approximately 7 p.m. At 10 a.m., John Doe was undergoing an elective spinal surgery at OSIS when he went into respiratory arrest, which led to cardiac arrest, specifically pulseless electrical activity. After 9 minutes of chest compressions and 3 rounds of epi, Rossi was obtained and intubation was performed at OSIS. At around 10:30 a.m., he was brought to the ED from OSIS where he was put on mechanical ventilation. At approximately 11:30 a.m., he was brought to the unit from the ED on a few drips. Those drips are as follows. An epi drip, which is running at 0.05 mics per kilogram per minute, a levo drip, which is running at 0.03 mics per kilogram per minute, a fentanyl drip, which is running at 20 mics per hour, a calcium gluconate drip, which is running at 10 milligrams per kilogram per hour, and a propofol drip, which is running at 25 mics per kilogram per hour. When he arrived, he was very cold. Specifically, he arrived at 34.9 degrees Celsius. After starting a bear hugger, his body temperature continued to decrease, and it went as low as 34.5 degrees Celsius, at which point we moved into an Arctic sun, which has been steadily increasing his temp since. The wife is in a room with him. Ventilator settings are as follows. Continuous mandatory ventilation at 6 mLs per kilogram for tidal volume, a respiratory rate of 16 breaths per minute, an FiO2 of 80%, and PEEP at 5 centimeters of water. John Doe is a 73-year-old male with a history of chronic back pain, hypertension, hyperlipidemia, and smoking. Notable past surgical history includes a myocardial infarction in 2010, which required a quadruple CABG. His chronic back pain is normally managed with PT and OT, which his wife reports doesn't help. Also, his wife reports that he used black market drugs to manage his pain. The only one she told us about was Oxy, which she says he used up to 10 milligrams a day of. She said there wasn't anything else, but she seemed hesitant and unsure when she said that, so there may be more that we're unsure of. Most read-in vitals are a heart rate of 62, a respiratory rate of 16 via the ventilator, a BP of 95 over 54 even with the 2 vasopressors, and 92% oxygen at 80% FiO2, again from the ventilator. And his temp is now 35 degrees Celsius, up from his low of 34.5. Dosing weight is 123 kilograms. Neuro-wise, he is intact, Perla is evident, GCS 4T. Lung sounds are clear, heart sounds are present, S1 and S2, with no auscultatable S3 or S4. However, the S1 and S2 are very faint. Pulses are very thready. We're looking at 1s over 1s. He is very sensitive to the epi drip. When you discontinue it, his BP plummets pretty quickly. This isn't the case with the levo drip. He was on 100% FiO2 when he arrived. We titrated down to 80 to see how he would do, and he's been maintaining the 92% oxygen pretty continuously. He is extremely hypocalcemic. Last lab draw from the ED showed a 6.8 for his total calcium. Since the incident occurred mid-procedure, he did arrive with an open surgical wound to his upper back. He has since gone to the OR where that wound was closed up. The elective procedure he initially was at OSIS for was not completed. They just closed up the wound. Wound was looking good, no sign of drainage or obvious signs of infection. It is dressed and padded, and you shouldn't have to worry about that over the night unless it becomes saturated. For recommendations, I recommend prioritizing the increase of his body temperature and getting his calcium back to normal levels. Additionally, I do recommend following up with the wife to see if there were any other black market drugs that he was on for his chronic back pain. Again, when she said there was nothing more than oxys, she was very hesitant and unsure to me, so I think there might be more that she can confirm if you follow up with her. I know the plan is to test out some spontaneous breathing and spontaneous awakening trials later on. I do not have a time for that, so you should follow up with the team. He is being followed by Medicine Rojo. I do know for sure that prior to that, they are going to attempt to take him off one of the vasopressors. Again, since he is so sensitive to the epi drip, I would recommend the levo first and then epi in time. Any questions?